Hello and welcome to another edition of Professor Speaks. Today we're going to talk about various topics centered around healthcare, which includes drug manufacturers on social media, organ transplants, and even skinny health plans. But before we get into that, I'd like to remind you to hit like, subscribe, and hit the little bell for notifications. Hello and welcome to another edition of Professor Speaks. My name is Alex Hernandez. Alongside me, as always, is Dr. Craig Stern. And our topic for today is actually various amounts of topics that are centered around healthcare that's in the news. And one of the topics that are in the news is drug manufacturers on social media. Now, I read this article in the LA Times not too long ago. It was sometime during this week, like Monday or Tuesday. And they're talking about drug manufacturers advertising on social media. So, Dr. Stern, what are some of the pros that can come from this? Because a lot of people are talking about the negative, but what are some of the positives that can come from this?
Yeah, this is kind of like a marketing argument, probably. Mm-hmm. Fundamentally, the issue on the pro side is manufacturers have been advertising on television, right, magazines, sometimes in the newspapers, etc.
So it makes sense, right?
Well, I mean, the argument is you have a particular disease, you want to know more about it. Mm-hmm. These ads are helping you to learn more about the disease. They're also letting you know that there's a treatment, because clearly there's a commercial interest in doing the ad, because not only are they telling you about diabetes or hypertension or whatever, but they're also letting you know that they have a drug for it that will improve your particular condition.
Right.
So fundamentally, that's the free speech argument for doing it.
And it's also a business trying to get their product out there to let the people know that there's something that could be a benefit for them.
True.
Right.
And several studies have come out looking at this, because the amount of money that's been placed into this is a lot. And it's been increasing year over year. In the world, Australia and the United States are the only two countries that allow advertising of drugs on media, namely TV and magazines, things like that. But social media, because of its growing interest and because people use it so much, is the obvious extension of where that goes.
Right.
There are multiple studies, on the other hand, that are looking at this, and they're saying, look, this argument that you're teaching people about disease is really not it. You're driving people to use particular drugs. Many of those drugs are too expensive. So as a result of that, all you're doing is driving them to brand name drugs rather than perhaps guidelines that say that generics could be used as well and lower their overall costs. And the federal government today, especially from CMS, is arguing to put the cost of the drug up on the ad so people can see, yeah, this is a very interesting drug, but you also see how much it costs. That hasn't had a lot of traction because clearly lobbyists from the pharmaceutical manufacturers, from Pharma, have argued against that.
But also the whole thing with cost is it's not the same cost everywhere. No. You'll have pharmacies paying. Pharmacy A will have it at such and such price, but Pharmacy B will have it at another price, and patients probably won't even see the price in some cases, like in generic versions, because it's covered, and then the patient just has to go and get it.
That's true.
So there's not really that much of an argument for putting the price up on the ad. What do you think?
Well, there's an argument for it, and that is to let people know how much this drug actually costs.
Okay.
The other argument is no, it may be free speech. On the other hand, we don't think that is a viable piece of information because of the argument you just gave. Yeah. People have insurance. You don't know what the total cost is. You pay your share of cost, like copay or deductible, whatever. And as a result of that, you don't really know what the total cost of the drug is.
Right.
At base here, we have a problem. Multiple studies have come out and said these particular ads just drive doctors to use more expensive brands. That's a very common theme in many of the studies.
Right.
And the question for everybody is, are doctors really aware of all of the differences between the drugs? Are they aware of the guidelines, and are the new drugs being compared to guideline therapy?
Right.
To say that it's not just placebo where you're not taking an active drug, but where you're doing it to guideline, and have you really made a significant improvement? That's the main argument today. Most drugs are not compared to guideline.
Right.
Because most studies today are what's known as non-inferiority studies, which in the simplest method is my drug isn't any better than anything else, but it's not any worse.
Right.
So if you're going to do it, I may have a few things that you like, meaning I'll protect maybe the heart, or I'll protect the lungs, or I'll protect the kidneys, or whatever. Or maybe I'm just easier to take because you can take me once a day instead of 2 or 3 times a day. There's those kind of arguments.
Right.
And then the question is, how much is that worth to you?
Right. Right. So then you have these advertisements, and it seems in recent years with the United States mostly that the people, the common people, or just the general populations, they're starting to become more aware of these advertisements and asking for less of them to be put on, right?
Yes.
So what kind of power can that actually have for the people from what they want?
Well, the issue is how well organized people are. Clearly, it's a free speech issue. So if I want to put something on that's free speech that doesn't necessarily harm somebody, but is just informing people, then I have every right to be able to do that, or to state my opinion, whatever that opinion is, pro or con. The money that is being spent to put these ads into social media, etc., is rising. So there's a lot of commercial marketing money to do that. There's clearly a reason for it. Sales go up. But it is hitting head to head right now with this whole transparency argument of, well, how much does this drug cost? And is it really life-saving, or is there something else that's available that could be helping me?
Right.
If it's truly life-saving, then the argument is, well, can I afford it? And if not, how do I get some way to get it for myself, or my family, or whomever?
Generic equivalent and all that.
Whatever, or switch, whatever. If it isn't, then the question is it's one of many. And now, is it worth it? And as we said last time when we were talking about value-based kind of programs, the issue is if you have a drug that has a 10% improvement, you can't charge 100% more for it and expect that it's going to be cost effective.
Right, right. Well, let's move on to the next topic. We wanted to talk about there was another news story that had list of organ transplants are shrinking.
Yes. Meaning
the population of donors is becoming less. So what?
Well, it's a little bit different.
Okay,
it's a little bit different.
Go ahead.
There are a list of organ donors that are opioid abusers who have died because of opiate overdose.
Okay.
Those organs have now been made available to people that need them to live, who are not opiate abusers.
Oh, okay.
So that they can live, they can flourish, they can lead normal lives now with these organs that previously there was a long list of people who needed them. There wasn't as much of an inventory of organs available, but now for this really horrendous reason, I mean, it's a horrible reason, that you're now looking at it and you're saying, well, wait a minute. This person died because of an opiate overdose. Maybe someone else can benefit because they couldn't. So that's one of the things that's going on.
So the opiates wouldn't affect certain organs?
Well, they could. And certainly there could be issues with regard to a patient's livers and some other organs, but especially livers that are involved. But the people that are doing and harvesting it, they have to take a look at these and make sure that we don't have a totally compromised functioning liver, for example, that we're trying to give to someone. It's like, for example, someone who's a constant drinker,
right,
and has effectively killed their liver. and they need a new liver.
Mm-hmm.
So when you're harvesting the liver, even if it's from somebody who died of an opiate overdose, you're going to check the liver to make sure that it's not so compromised. You're giving someone a new liver, but it may also be compromised for that. But in these cases of what they were reporting in the paper, it was a case where they were making the inventory of available, relatively healthy tissues
Right.
available to people that needed them to live.
But how is this possible? If you have an opiate abuser that, I mean, they obviously abused opiates and it caused their death. I'm finding it hard to put two and two together where you can have an actual functional liver that can be passed on to somebody else who needs it.
You know, it depends. It really depends. Whoever is harvesting that liver has to test it, make sure that it's a truly functional liver and that wasn't the reason that they died.
Right.
And then given that it's healthy enough that they can, then they're going to do it. Opioid overdoses can occur because you take too much and people stop breathing. So the liver may be okay, but the patient may have died because they couldn't get oxygen.
Okay.
There may be, in the case of opiate overdose or even controlled substance overdose, that there's some cardiac implications, and so they die because of that. So perhaps the liver is okay, but you have to check it. I mean, this isn't a simple thing where you immediately say, "Oh, well, everything is fine. I'm just going to harvest whatever I'm going to harvest and deal with that." The answer is no, and depending on what happened and what the reason was, they may be able to harvest more than one organ. Maybe the eyes are okay so that they can give it to someone who needs an eye transplant. They may be able to give it for someone who needs a kidney transplant, perhaps a liver transplant, whatever. So there's other options that they can do in order to try and help these other people live. It's a horrific idea.
Right.
But it is also what's happening. But it does lead to something else. So as you get your questions, I want to bring something else up.
Oh, why don't you just go for it? Yeah.
Well, this issue, horrific as it is, nobody is trying to apologize or give excuses or anything. It's horrific. But it's also leading to something that is happening more and more, and that is drug-induced disease. As the amount of drugs is increasing and the number of people on drugs and on multiple drugs is increasing, what this has done is to make the world and people who come to see the doctor, make them think of the different things they have to think about when they're taking symptoms and saying, here's symptoms, here's laboratory, let me try and understand what's the matter with you.
Right.
And they do what's known as a differential in order going down a list, a deductive list to figure out what's the matter. In the top 5 now is drug-induced disease. You always have to ask, what drugs are you on?
Right.
Because drugs may be the cause of a problem, and the
multiple problems.
Absolutely, absolutely. So the issue here of opiates is one of them. Clearly, it's a horrible situation, but it's a situation where people need to pay attention to and understand that you need to keep your list of drugs all the time. You need to always be aware, and you always need to ask the question, are there any drugs that I have that can be causing these symptoms or these problems?
Right. Well, let's move on to another topic because we're running out of time here. And I wanted to talk about skinny health plans. I believe we've talked about this before, but I wanted to go more into detail about it because there is an election coming up, too. And I'm sure something on the ballot is going to be regarded to either some form of health care or GOP or Democrat liberal health plan, whatever they want to call it. We're not going to get into politics. But the skinny health plans, they're cheap, but what exactly do they cover?
Well, that's the problem. And irregardless of the political arguments, and there's a lot of them.
Yeah.
But the issue here is the following. People have addressed the fact under Medicare, under Medicaid in each state, under much commercial insurance, and also under the Affordable Care Act, where there is a group, a group of diseases pardon me, there's a
We can
group
edit
of
that out.
diseases that are covered.
Uh-huh.
And you can always make a cheaper plan by removing things that you don't have to cover. Like, for example, perhaps you remove ambulance, you remove some vehicles in order to get to an emergency room.
Right.
Or maybe if some particular insurance only covers emergency or emergent issues, doesn't cover time in the hospital, perhaps it doesn't cover time in a step-down a skilled nursing facility or otherwise.
Right.
Certainly you need to look at the formulary and see if drugs that you're on are covered.
Mm-hmm.
In skinny health plans, in most cases, branded and the most expensive drugs are not covered, which means that you're totally responsible for the full cost. Now you find out what the cost of the drug is.
Right. And if you do, I mean, Good RX, and we can put that back up on there. We have links to comparable drug prices that are centered around where you are located.
And understand, we're not trying to promote GoodRx or anybody else. What we're trying to say is you need information. There is sources out there for you to compare drug costs from pharmacy A, B, C, D, etc.
Mm-hmm.
But an expensive drug is an expensive drug. It's
Right.
not going to go from being an expensive drug in pharmacy A and an inexpensive drug in pharmacy D. It's not.
Right.
So in that regard, the skinny health plans are skinny for a reason. It brings up, though, the issue where in politics, the Republicans now are saying, well, we're not going to take away anybody who has a pre-existing condition. We've talked about this before. A pre-existing condition are people that have chronic disease.
Mm-hmm.
They have diabetes, they have hypertension, they have hyperlipidemia or high cholesterol or whatever. These particular diseases are typically not covered or covered to significant limitations in a skinny health plan.
Right.
Because the cost of them is very large, and all of these services that can be given, the drugs that can be given, going back to the doctor, the laboratory tests, x-ray, etc., are very large. So frequently in these programs, it is very limited and there's restrictions on them as to what can be done, so that you know that only this part of what's happening to me is going to be paid for and the other part is not going to be paid for.
Right. Well, in those cases, you have doctors that are limited as to what they do, but they don't know what your insurance most of the time. They don't know what they can and cannot do. They're gonna do the best job that they can, provide the best quality service. So in those cases, the patient will just have to man up and get the cost.
Well, the patient will have to man up, get the cost, but before they do it, they need to go on the internet or wherever their information source is and find out what is covered.
Right.
And the doctor's office, and doctors are getting more and more strained. The issue of doctors who are strained, who are falling out of the system, etc., is rising. But
Well, what does that mean, falling out of the system?
It means that doctors are looking at this and saying, you know, I came in to treat patients, but now all the paperwork, all the issues about whether it's covered, issues whether people can afford the therapy that I'm prescribing, people are putting a lot of strain on. As a result of that, doctors are burning out fast. And as a result of that, there's a lot that are dropping out of the medical profession, or they're limiting the amount of patients that they see. It's a huge problem within the doctor population, but it's also a huge problem to everybody else, because it's one thing to get a skinny health plan that doesn't cost much, and that may be okay for someone who has no medical problems.
And okay for someone who wants to avoid the tax penalty.
Yes, absolutely. On the other hand, that doesn't stop you from having, God forbid, automobile accidents or falling, breaking something or otherwise, because in those cases, frequently, if your insurance doesn't cover it, then you're responsible for the entire cost of it. So making promises, political promises that say, irregardless of the politics, but making these promises you're going to keep it is counterintuitive, because these things do cost. And as a result of that, the government is going to pay for them. the state is going to pay for them, or you're going to have to get insurance that covers to pay for it, or you're going to pay for it.
Right.
So making these kind of irresponsible statements that you're going to cover is just people who don't understand what's going on. There's no free lunch here. Somebody's going to have to pay for it because people are spending time. There's resources, there's laboratory tests,
Right.
there's drugs. All of these things cost.
And it's jarring because I don't think when they make the statements, they're really thinking about it. It's, please follow me. I'll take care of you. Those kind of statements, and really with no cause of action to cover it.
Yeah, and that's the problem. From a medical standpoint,
Mm-hmm.
we need to make sure that we have the capability of treating people the way they need to be treated. We've talked a lot about options where they can lower their cost.
Mm-hmm.
But at the end of the day, you need to be able to find something that is going to cover the things that either your problem, your spouse, your children, your family, or even looking ahead in your family and seeing what the history is, that you're going to cover what could very well happen to you because of your gene pool.
Right, right.
Yeah.
Well, and you could also just get a skinny health plan and then surround yourself in a big bubble, and you can think everything's okay. If only that was possible, right? Well, that's it for today, and we'd like to thank you for watching. And Dr. Stern, if you have anything else to add?
No, I don't. Have a wonderful week.
All right. Thank you very much, Dr. Stern. And that's it for today. We'd like to remind you to go to propharmaconsultants.com. We have information there from pharmacy benefit news, also to articles written by Dr. Stern himself. If you want any more information, or if you have a question for us, please feel free to leave a comment below. And we'd like to remind you to hit like, subscribe, and hit the little bell for notifications. See you next week.